Have you ever stopped to think about the power of a well-crafted mental health program? What if I told you that the key to transforming communities lies within our grasp through the art of understanding and intentionality in our program design? My name is Christina Broderick-Royes. I'm a licensed social worker and the founder of Intention Elevation, a consulting and education firm transforming the way the world approaches mental wellness. And today we're focusing on building effective mental health programs. So whether you are a director of a nonprofit, a manager at a Fortune 500 company, a high school principal, or an entrepreneur building a program to offer to the community, you're in the right place. In a world where mental health needs are rapidly evolving, all of us face a profound responsibility. Because here at Intention Elevation, we believe that mental wellness is all of our responsibility. And so we're not just addressing issues, we're shaping healthier futures. And so then how do we ensure our programs don't just exist, but thrive, making a lasting impact on those that we serve? Imagine being in a small, bustling community center and you hear a young mother share her struggle to find culturally sensitive mental health support, or a teenager talks about the stigma he faces at school. Or maybe even a parent is sharing their challenges with work-life balance and that their manager isn't understanding. It's in these real-life stories that we begin to understand the true needs of our community. And so to begin the journey to building effective mental health programs, we like to use our framework of evaluate, establish, and elevate. And so first, we must evaluate the current state of our programs in our communities. We have to assess what's working, right? Like looking at the program, the community design, the needs of the community, and then any historical data that we have. Because from there, we can then analyze this information. And so we like to recommend folks to do a SWOT analysis, but from a mental health lens, right? And so looking at the strengths, the weaknesses, opportunities, threats, and you can design it kind of like this, right? Strengths, opportunities, weaknesses, threats in this quadrant. And so what's working well when it comes to the way that you are approaching mental health in your program? What is not going well in the way that you approach mental health in your program? What support is available outside? And so this is thinking externally, what support is available? And then lastly, the threats. What are the things that are getting in the way of you being able to run the effective program that you want to be able to run? And so doing an effective SWOT analysis from a mental health lens can be extremely helpful for you doing this part of the evaluation phase. Okay, so then we need to then align to our purpose and our vision, right? So create the vision first. What do you want the program to look like? What do you want your community to feel like? What do you want them to experience, right? What is the vision? Because from that vision, then you can create a plan. And so based on this information that we've gathered through our data collection, right, doing this assessment, we can then determine what our goals are going to be, what our priorities are going to be, and what the needs are going to be. So from there, we can move to the next part of the framework, which is establish. And so this is first, you need to establish content. We unfortunately still live in a world where there is still a lot to learn when it comes to mental health and wellness. And so we have to be able to strengthen that knowledge base around mental wellness. And so thinking, what's the necessary foundational content that is required to cover within my programming so that we can hit the goals, right? So that we can have that outcome we're looking for. What does the community need to learn about? For example, maybe you want to have effective programming around stress management. Well, what do they need to know about stress, right? The different kinds of stress, how stress impacts their body, so that you can develop some effective programming around it. Maybe you want to have a program around anxiety reducing strategies. Maybe you want to have a program around moms and mental health, or mental health in the Black community, right? What are just some foundational knowledge things that folks need to learn so that we're able to build an effective program? Because then once we have that, we can connect that content to the need. And so this is where we start to design and develop those programming initiatives based on what we've gathered so far and where we're looking to go. And then lastly, we want to establish community. A huge part of mental wellness is community and connectedness. So that must be a critical part of your work. So after you've done all that, then we can elevate, which means that we actually do the work. We get the program going, but keeping in mind that it is an iterative process, meaning you must have frequent check-ins with these initiatives. There should be progress monitoring, data collection, data assessment, right? All of this needs to be continued effort, because then from there, you can keep making progress forward. So building effective mental health programs goes beyond just meeting the needs. It's about empowering and nurturing communities through intentionality and through commitment. Imagine a mental health initiative born from such a series of intentionality, where local members and staff and community folks can come together with an end goal to develop a mental health program that is tailored to the unique needs and cultural dynamics of their community, and to develop a program that not only addresses the current mental health needs, but also empowers the community members to be a part of the solution and thinking through being more proactive and preventative going forward. Or maybe an initiative that is focused on school-based mental health support or employee mental health and well-being that is integrating evidence-based approaches with cultural competency, training teachers, training staff, right, to identify and address mental health issues in ways that keeps them in their lane, in a way that resonates with those of diverse backgrounds, leading to increased engagement and overall improved well-being of the community. Or maybe even a campaign that connects with local businesses and philanthropists, presenting their vision for a community-based mental health program, and through transparent and passionate approaches results in substantial funding that helps ensure the program's sustainability. Each story, each program, each effort brings us closer to a world where mental health and well-being is a fundamental right for all. With that said, thanks for watching. As we continue our mission, let's remember the power of understanding, intentionality, and action. Until next time.